Hi everyone, this is Colleen Thompson, and I am one of the leaders this week. And I am excited to have this conversation with you this week. I hope I fulfill my expectations as a leader, and hopefully, we can have some good conversations and learn and grow from these conversations. The first question on this assignment was, what is the second victim phenomenon? The second victim phenomenon is whenever a medical professional makes a medical error, and first and foremost, it does affect that patient, of course. But at the end of the day, the second victim is the person that made that mistake. As a medical professional, you treasure and you hold dear your medical license. You've worked so hard for it, and you do everything every day, every patient, every moment of the day. You're constantly watching out for errors, making sure you're doing the right things, watching out for your patient, advocating for your patient, and you make an error that affects that patient. The guilt is unreal. And it's something that you take home with you that affects your personal life. It makes you question, like, am I even good at this? Am I even supposed to be here? It's a very difficult situation, and I think we've all made medical errors or medication errors. Definitely, I think the majority of nurses learn from them and will never let that one mistake ever happen ever again. So that is the second victim phenomenon. The second thing is, what does suffer in silence mean? Suffer in silence means that you have your really, really bad day at work, you make that medical error, that medication error, and then you go home and you suffer in silence. And to me, I think that we have so many resources for the patient, which is outstanding. You have social services, you have psychiatry, you have all of the departments, you have all the resources for the patient. But the person taking care of the patient sometimes needs a person to talk to, and to not allow to suffer in silence to any of the nurses. I think that we all need someone to talk to, whether it be in your personal life or as a nurse. The poor Kimberly Hyatt case, it sounds like she suffered in silence for 7 months before she took her own life. And I know that it sounds like she had a really good family support system, but to have support from your coworkers and your peers in the medical profession, I feel really, really, really sad for her. I feel like, she worked at that hospital for 24 years. Obviously, she was a very good nurse. Obviously, she always did the right thing, except for that one time. And that one time possibly hurt that little infant. That infant had a lot of heart troubles anyways. I'm not justifying her medical error at all. I'm just saying that I think that we're all humans. I pray that this sort of thing never ever happens to me or anybody that I know. If it did happen to one of my coworkers, gosh, I would feel for that person, and I would let them know that I am here to talk to them. I would try to be there for them, and I would not let them suffer in silence. I think as a hospital, I think that we should have a person, a counselor for the nurses when something like this happens. Just a hotline maybe, or someone that we can talk to, to support us, to be there for us, to make sure that we're reporting it, of course, and to be more of a someone to just emotionally support us. So, suffer in silence comes from a lot of things. There's fear of repercussions, there's shame, there's guilt, there's not being supported by your coworkers, legal implications, like, am I going to get my license taken away? Am I going to get fired? What am I going to have to do now? There's a lot of worries when something like this happens. And it sounds like the Kimberly Hyatt case, as tragic as it was, I feel for Kimberly Hyatt. She punished herself more than anyone could have punished her. I feel terrible for the family of that poor infant. They were going through a lot, and I just feel like both parties should have had some counselors, somebody to talk to. The second question on the assignment was, how does the ANA Code of Ethics for Nurses provide guidance about a situation like the Kimberly Hyatt case and other medical errors? The ANA Code of Ethics provides patient safety and advocacy. The code would support her commitment to the patient's safety, but also guide her and support her to reporting the error and ensure transparency. The code would help with accountability and responsibility. The code encourages nurses to acknowledge the mistake, report it, and also encourage the nurse to go about a way that they can figure out a way to not ever let this happen again. Maybe put some things in place to where it kind of prevents this from ever happening again. And lastly, discuss the Redonda Vaught case and how it influences the second victim phenomenon. Redonda Vaught, to me, was a very sad case. As a medical professional, as a nurse, I saw her point of view. I know that, and I can tell in her interviews and everything, that she did not ever intentionally make this error. It sounds like she had an orientee with her that she was trying to teach somebody while doing her job, which sometimes, some days your patient load is too heavy. You can't, some days, I work at a teaching hospital, and I feel like, gosh, a student on top of all of my other things, which sometimes the students are take initiative. They get right in there. They help you out. They want to learn, and that's great. But then other times you have students that are just there to get their hours. You want to answer all their questions and everything, but losing that focus on that patient, is very important. You cannot lose the focus on what you're doing. You get the med out of the Pyxis, you check it, you have to override it, you better be checking it. You better be scanning it in the patient room. You better be scanning the patient bracelet. You better be double checking the patient bracelet, asking the patient their name and date of birth. Also, that's good for the orientee to know as well. If she, who knows? It sounds like maybe she was helping the primary nurse for that patient out. It was probably a pretty busy day. Still does not condone the medical error that was made. Somehow that vial of medication was not scanned, which could have prevented this major medical error that took the life of that 75-year-old woman. On the other hand, I felt like Redonda Vaught was very sincere, and I felt really, really sad for her, because I felt like she was probably a really good nurse, and always watched out for her patients, always tried to help out. She worked at a really good hospital, very reputable. Maybe the hospital didn't want to take help support her and take, kind of the responsibility of saying, hey, we didn't have these safety requirements to, scan that med, or maybe it was a medication that they override in the ICU, and someone from the pharmacy put it in the wrong slot, or, I don't know. I just feel like there was some things that they could have done as the hospital to prevent this from happening. But I also know as a nurse that there are a lot of times in emergency situations, or any time really, that you have to override a medication, whether it be IV fluids or whatever. But if you do that, make sure that you are giving it to the right patient, the right time, all the rights are met. And the second victim phenomenon on that, she, I know, as watching all of Redonda Vaught's interviews and stuff, you could tell that she was a second victim. She felt a tremendous amount of guilt, and I felt like she was very sincere. And it sounds like now that she's kind of reflecting on her decisions, and she's probably suffered in silence a lot. I'm hoping that she has a really good support system. It sounds like she's getting some therapy with her lifestyle right now, and that's something that she'll always carry on with her for the rest of her life. That one mistake killed that patient, and I cannot even start to imagine the guilt that she feels every day. It could happen to any of us. We just have to be very, very careful, and know that if we override anything, triple, quadruple check that it's the right drug. And, in pharmacy, they make mistakes too. They put stuff in the wrong slot. You got to make sure that everything in that slot is correct. If it's not, report it immediately. If there's not a way to scan it in the patient room, get a second nurse to check it with you. It's not, it's just a safety thing. This could have been prevented. So after a lot of this discussion, and I'm sorry I'm going a little bit longer than I expected to, but after completing the readings and this assignment, I have developed a critical thinking question. I hope that it kind of sparks some good conversation. So here we go. Here's the question. In light of the Kimberly Hyatt and the Redonda Vaught cases, how can healthcare organizations strike a balance between accountability for medical errors and providing supportive environment for healthcare professionals to cope with the second victim phenomenon? I'm excited to have these conversations with you this week, and I get on, I check the assignment, the course every day on my computer. So I will be in touch, and I hope you guys all have a very good week. Thank you.